Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Tylenol versus Advil. What's the difference? Tylenol, acetaminophen, is only effective at relieving pain and fever, but Advil, ibuprofen, relieves inflammation in addition to pain and fever. Other differences. Some research suggests NSAIDs such as Advil are more effective than Tylenol at relieving pain. Advil is NSAID, so is not suitable for everybody and can cause GI adverse effects, cardiovascular adverse effects, and kidney toxicity. This risk is low if no more than 1,200 mg of Advil is taken per day. Tylenol appears to have more adverse effects than traditionally thought, and this risk increases with higher dosages. Any medication used for pain relief should be taken at the lowest effective dose for the shortest possible time. Either Tylenol or Advil may be used for headaches, fever and minor aches and pains, but Advil is more effective for strains or sprains. Tylenol is a brand of acetaminophen. Acetaminophen relieves pain and also reduces fever. Experts aren't sure exactly how acetaminophen, Tylenol, works but believe it affects COX enzymes in the brain, reducing the formation of prostaglandins. Prostaglandins are substances released during injury that cause pain and inflammation. There are many different brands of acetaminophen in the US, examples include Aceta, Apra, and Mapap. Acetaminophen may be called paracetamol in some countries. Advil is a brand of ibuprofen. Ibuprofen is an NSAID and relieves pain and fever and also reduces inflammation. Ibuprofen, Advil, also blocks COX enzymes, but to a different extent than acetaminophen. It is considered a non-selective NSAID because it blocks both COX-2 enzymes, involved in pain signaling and inflammation, and COX-1 enzymes, associated with a protective effect on stomach lining. This makes it effective at relieving pain and reducing inflammation, but there is a risk of stomach-related side effects. Ibuprofen belongs to a group of medicines called NSAIDs. Other brands of ibuprofen available in the US include Genpril, Midol IB, Motrin IB, and Proprinol. Which one works for longer? Tylenol and Advil both work for a similar length of time. Tylenol is short-acting with a relatively quick onset of action. Pain-relieving effects last for 3 to 4 hours, however, it is important Tylenol is not taken more often than every 4 to 6 hours, and the maximum of 4,000 mg, 4 grams, per day, 24 hours, is not exceeded. In some cases, see below, a lower maximum dose, 3,000 mg/day, should not be exceeded. Advil is a short-acting NSAID, with a relatively quick onset of action. Pain-relieving effects last for approximately 4 hours. Like Tylenol, it is better suited for the treatment of acute pain. Ibuprofen tablets/capsules can be given every 4 to 6 hours. If you are taking Advil over the counter, the maximum recommended daily dose is 1,200 mg. Do not take more Advil than recommended without consulting your doctor. Which one is more effective? Tylenol controls pain and fever but does not control inflammation, so for conditions such as muscle sprains and cramps, Advil will be more effective. One review showed that acetaminophen had little benefit in the management of osteoarthritis. Risk of side effects. Acetaminophen, Tylenol, has traditionally been considered relatively free of side effects. However, a 2015 review questioned that assumption and concluded that dosages at the upper end of the recommended dosing range were associated with NSAID-like adverse effects, such as an increased risk of heart attack and stroke, gastrointestinal, GI, ulcers and bleeding, and detrimental effects on the kidney. Use of acetaminophen for more than 13 weeks is also associated with a fall in hemoglobin, the oxygen-carrying component of blood, similar to that observed with ibuprofen. Experts still consider acetaminophen a safer option than NSAIDs for older or frail adults, as long as dosages given are at the lower end of the recommended dosage range. Acetaminophen appears to have a narrower window of safety compared to ibuprofen, and people taking acetaminophen should be warned that higher dosages may irreversibly damage the liver. All NSAIDs are associated with a risk of GI, cardiovascular, and kidney adverse effects, some more than others. Ibuprofen Advil is less likely than many other NSAIDs to cause GI side effects because it is short-acting. Low-dose ibuprofen, in dosages up to 1,200 mg per day, has a low risk of causing adverse cardiovascular events such as a heart attack or stroke. However, higher dosages of ibuprofen, up to the recommended maximum of 2,400 mg/day, are more likely to cause these effects. People who have already had a heart attack or stroke should talk to their doctor before using NSAIDs. One study showed that even 1 or 2 doses of ibuprofen or diclofenac, another NSAID, increased the risk of another cardiovascular event in those with a pre-existing risk. NSAIDs should also not be used after coronary artery bypass graft, CABG, surgery. NSAIDs have also been associated with allergic-type reactions and can interact with other medications including angiotensin-converting enzyme, ACE, inhibitors, angiotensin II receptor blockers, ARBs, diuretics, clopidogrel, warfarin, dabigatran, and aspirin. The 2015 study cited above also found that the risk of hospitalization for GI adverse events was significantly increased when acetaminophen and NSAIDs such as ibuprofen were combined. However, many experts still consider it safe to take acetaminophen and ibuprofen together for short periods of time, such as a couple of days, provided recommended dosages are not exceeded. To reduce the risk of side effects, it may be better to do alternate dosing, for example, Tylenol at 8 a.m., Advil at 12 noon, Tylenol at 4 p.m., Advil at 8 p.m. Related questions: what's the best sore throat medicine to use? What is paracetamol, Panadol called in the US? Advil, ibuprofen, and Tylenol, acetaminophen, together, is it safe? How to take them safely? For Tylenol, the generally recommended maximum daily dose for the average healthy adult is no more than 4,000 mg, 4 grams, a day, from any source. Acetaminophen is also contained in many combination cold and flu remedies, and in combination opioids such as Vicodin and Percocet. However, in some people, dosages close to 4,000 mg/day could still be toxic to the liver. Consider erring on the side of caution, particularly if you are small or frail in stature, and take no more than 3,000 mg/day. Regular strength Tylenol contains 325 mg acetaminophen per tablet, and extra strength Tylenol contains 500 mg acetaminophen per tablet. The maximum dose for extra strength Tylenol is now 6 pills per day, 3,000 mg/day. And extra-strength Tylenol should not be taken more often than every 6 hours. Don't drink too much alcohol, no more than 2 standard drinks/day for men and 1 drink per day for women, if you are taking Tylenol, as this can cause the liver to convert more acetaminophen into toxic byproducts. If you are taking any other medicines, check with your doctor or pharmacist before taking Tylenol. When taking Advil, take only the lowest possible dose for the shortest possible time. Total daily dose should not exceed 1,200 mg. Do not take any other NSAID containing products while being treated with Advil. Do not double up on acetaminophen containing products. In people with pre-existing heart disease or who have suffered a heart attack or stroke, Advil should only be used with caution and only under a doctor's supervision. Older patients, patients with type 2 diabetes or with a history of stomach ulcers, kidney problems or at risk for heart disease are more likely to suffer from NSAID-related complications such as GI side effects, cardiovascular events, and kidney toxicity. Advil should be avoided unless your doctor recommends it and is monitoring you. See also, drugs.com compare tool, Advil versus Tylenol, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.